Now, legally, I can still proceed, but we can't take any votes, correct?
Yes, sir. We can go ahead and read the agenda and break for public comment.
Okay. Then let me start off by first saying happy birthday to Councilmember Wynn.
Thank you, thank you, thank you. I'm only 15 today.
You're 15, and I hope you have many, many, many more.
Thank you.
Let me start off by reminding the public that the COVID-19 pandemic continues to preclude us from meeting safely in our council chamber. We must therefore operate in this virtual fashion using public comment guidelines outlined by the Louisiana Attorney General. At the beginning of the meeting, the council staff will read the agenda for today's meeting in its entirety. That agenda is also online at council.noaa.gov. Anyone wishing to comment on any agenda items should go to council.noaa.gov and fill out an online public comment card. Only written public comments will be accepted. Public comment will be limited to 1 comment per person per item. Comments should also be limited to 2 minutes when read aloud and be germane to the agenda item at hand. Public comment will be closed at the end of the 10-minute public comment period. This will be announced and no written comments will be accepted beyond that point. Before voting on any agenda item, the council staff will read any public comment received for that pending agenda item. So with that, if we could please have the agenda.
Yes, Councilmember. The Community Development Meeting agenda for Tuesday, May 4th, 2021, 10 a.m. 1, roll call. 2, approval of the minutes from the April 13th, 2021 meeting. 3, COVID-19 vaccination updates. Presenter, Jennifer Avegno, Director of the New Orleans Health Department. 4, reopening of the New Orleans City Council chambers and other COVID protocol updates. Presenters, Paul Harang, Interim Chief of Staff of the New Orleans City Council, and Jennifer Avegno, Director of the New Orleans Health Department. 5, Ordinance Calendar Number 33,305, Sale and Possession of Fentanyl Test Strips. Ordinance Calendar Number 33,305, an ordinance to amend and reordain Section 102.15 of the Code of the City of New Orleans to provide for an exception to the article allowing for the sale and possession of fentanyl test strips. Presenters, Jennifer Avegno, Director of the New Orleans Health Department, and Emily M. Nichols, Director of New Orleans Emergency Medical Services. 6, Community Visions Unlimited, a presentation on programs to rebuild neighborhoods through art, beautification, and empowerment. Presenter, Jeannie P. Tidy, Founder and Vice President of Community Visions Unlimited. 7, adjournment. That is the complete agenda.
Thank you, ma'am. So with that, we will stand down for 10 minutes for the public comments. And what time shall we return?
At 10:14, sir.
10:14, we will return. So we will stand down until then, and we'll see you all at 10:14. Thank you.
Can't get this unmute off now.
All right, Ms. Tidy, we have you muted. The council is in recess for about 10 minutes, and then we'll come back.
Okay.
Good morning again. It is 10:14, and we have extended the required time for public comment. So with that, I think we do now have a quorum. So ma'am, would you please call the roll again, and let's establish that we do have a quorum?
Yes, sir. Councilmember Banks present. Councilmember Moreno.
Present.
Councilmember Gustafson Palmer.
Present.
Councilmember Brossette. Councilmember Nguyen.
Here.
We have 4 council members. We have a quorum.
Thank you. With that, can I get a motion to approve the minutes from the April 13th meeting?
So moved.
Thank you, Council President. I will second. All in favor, say aye.
Aye.
Any opposed? Okay, so with that, we will move on with the agenda. And I'd like to introduce Dr. Jennifer Avegno. Dr. Avegno will provide updates on the COVID-19 vaccination efforts in New Orleans. And if you would, Dr. Avegno, good morning.
Good morning. Thank you, Councilmember Banks. And happy birthday, Councilmember Nguyen. May the 4th be with you. I think we're supposed to say that. So I'm pleased to speak on a number of topics today. Thank you all so much for having me. But we'll start with vaccines. I don't have the most up-to-the-minute update for you because the data was delayed yesterday, but I can tell you that as of late last week, over 43% of our entire population of the city received at least 1 dose, and that translates into 54% of our adult or eligible population. We are on par or exceeding the national average for those rates, which is excellent. Of our seniors, over 2/3 of our 60 and above have gotten at least 1 vaccine. And that, again, is very, very, very promising because we know that they have suffered the most risk. We are, though, definitely in a period where our demand is far less than our supply. We have ample supply of vaccine, Pfizer, Moderna, and Johnson & Johnson, which I'll talk about in a second. And we are not seeing the huge demand that we were several months ago. This is occurring all over the nation, but it is particularly salient for us here in New Orleans. At the same time, we are not where we need to be in terms of full protection. And with the announcement last week that the Brazilian variant was discovered in the New Orleans region, that's just another reminder how important it is to reach a high level of vaccinations before those highly contagious, possibly more severe variants have a chance to take hold and spread and cause outbreaks, just as you're seeing the tragedy in India and the surges that have happened in other states. So our goal for full vaccination remains. We have begun to use Johnson & Johnson again since we last met. Johnson & Johnson was thoroughly reevaluated by the CDC and found that the low risk of serious complications was far less than the benefit of providing protection from COVID. So we have provided education with a video explaining Johnson & Johnson, explaining the rare side effects by one of our local specialists in sort of blood disorders. That's available at NOLA Ready for anyone who wants to learn more. We have started, and several of our partners have started to use it at events, and I'm happy to say we've gotten a lot of interest in it. So there's still a lot of people for whom Johnson & Johnson is a good choice, but we have other choices as well. We really need now everyone who has been vaccinated to convince one other person, or to at least talk to them, educate them, explain why you did get vaccinated. If we do that, then we will very quickly approach 75%. And just lastly, the good news that came out yesterday is that the Pfizer vaccine will sometime in the next week be approved for children 12 to 15. So this significantly expands the number of our residents who are going to be eligible. And so we're working with our systems to figure out how the best way is to get our younger kids, especially as they're heading into summer camps and all the things they might like to do, availability of the vaccine. Councilmember Banks, it looked like you had a question.
Oh, no, actually, I have several questions, but I was waving at someone waving at me, but you continue. I will. Ask you
No,
if you.
that's sort of an overview, but I'm happy to fill in any gaps for folks.
Well, I was asked, is there a downside or is there some benefit to having two of the three or all three? If someone got a Pfizer and then decided to get a Moderna and a Johnson & Johnson, does that give them more immunity, or does that put them in a more in a position where it could actually hurt them?
Yeah, there's no reason to suspect you would get more immunity. Really, it's that first dose that primes the system and the second dose that really teaches your system what to do. Any further exposure is not going to get you any benefit, and it comes with a lot of side effects. So that really hasn't been studied. It's not recommended, and it really isn't going to offer you any more protection than just getting a whole series of one of the vaccines.
And in terms of the vaccine being available to the children, do we anticipate once we inoculate children, that'll get us up over the total population percentage that we need for the herd immunity, or will we still be short?
It'll get us a lot closer. I have to do the math to see what percentage of our population, but certainly the only individuals that'll be left unvaccinated are our young kids, our young kids are, not 25% of our population. So if everybody that was eligible, or nearly everybody, took the vaccination, we would be pretty close to herd immunity, if not there.
And New Orleans, on the spectrum of United States cities, where are we in terms of that percentage?
So we're doing well. I believe the last data that I saw nationwide, about 50% of all eligible adults have gotten a shot. And we're above that. We're definitely doing one of the top parishes in the state. Again, the only parish that has a higher vaccination rate than we do is West Feliciana, where Angola is housed. And so they're vaccinating a lot of their inmates. I'll say this too, there was a really interesting analysis of cities in regions, South, Midwest, by their vulnerability level. And as many of you know, the New Orleans ranks very high on our social vulnerability in terms of our needs. We are leading the South and leading most other cities that are like us in terms of having a high percentage of people in poverty and with significant social needs. We are one of the outliers doing quite well. And again, I think that's a testament to our governmental leadership. I think it's a testament to our health systems really being proactive and not waiting to be told to have events in communities, to engage folks on the ground, to go door to door. We've been doing that from the beginning rather than just realizing a few weeks ago that that's something we needed to do. So we're doing well, but the slowdown has me very concerned.
Is there anything that another city is doing that we aren't doing that we should be doing?
Yeah, that's a good question. There's a lot of cities that are providing a variety of incentives, and that's something that we are looking at doing. I think that will get us a little bit of the way there. And some are, everything you can think of, not just shots for shots, although we did invent that. So we'll take credit for that, I think. There are a lot of cities like we are that are deploying folks into neighborhoods. That's something we're trying to increase, and we appreciate the work of Nola Reddy and our neighborhood engagement office to help us just get more boots on the ground. We're also starting to work with barbers and beauticians, which I think is a very fruitful partnership, and I know is happening in other places. And trying to increase our mobile ability, so our ability just to be on the move even more so than we are now. I had a conversation with one of our healthcare providers about that a few minutes ago. It's really about being nimble. I would like to also figure out how we get into schools while schools are still open, so we can get as many of those kids as possible. There are some issues there around, parental consent, and do parents need to be present, that I know the state is working on. That would help us as well. But we continue to look for innovative, creative solutions that are appropriate for New Orleans.
Colleagues, do you have any questions?
I do. Dr. Vecno, on the children, do you guys plan to work with pediatrician? Because as a parent, I just feel like, because I'm taking the boys for their checkup before school start?
Yeah, that's really where I think the money's going to be with kids, because we all have to get that form signed for schools. The challenge has been that with these, the way the vaccines are shipped and packaged, it's in a vial that once you open it, you've got to use everything, right? And so it's not like a typical vaccine where that vial of tetanus or whatever it is, you take a shot and it goes back into the fridge. That is the highest priority for the state and for us when we're talking to sort of national leaders in vaccine, is make it so that the vaccine will come in individual syringes, so that you just pull out a syringe. You don't have to worry about, okay, I'm seeing this kid, I'm going to give them their shots, but now I got to work and get 6 more kids in, or I have to throw away the shots. Once that's figured out, and I think now that it's coming out for kids, they're going to have to figure that out if they haven't already. That'll make it a lot easier for pediatricians. But we do expect that this should be available to pediatricians, hopefully in the summer, which would be perfect timing for going back to school.
Cindy, you have any further questions?
I'm good, thank you.
Colleagues, anyone else? Doctor, before I let you go, I want to mention that there are several upcoming vaccination events in District B on Friday, May 7th from 8 to 12, 8 a.m. to 12 p.m. The vaccine being administered is Pfizer, and it's at the New Hope Baptist Church. On May 11th at Union Bethel from 2 p.m. to 6 p.m. That's Pfizer, that's at 2321 Thalia. Propeller at 4035 Washington Avenue and Broad. That's Thursday, May 13th from 4 p.m. to 7 p.m. And they will have both Moderna and Johnson & Johnson. The First Evangelist Baptist Church at 1801 Willow will host a vaccine event on Saturday, May 15th from 8 a.m. to 12 p.m. And that'll be Pfizer. And at the New Zion Baptist Church at 2319 3rd Street, that'll be Wednesday, June 11th from 8 a.m. to 12 p.m. And that's Pfizer. And we will continue to work with you to get as many additional sites and vaccine opportunities as possible. So with that, Doc, thank you. We will move on to the
Council Member Banks.
Wait, somebody. Was that you, Kristen?
Yes, it was. How are you?
Good morning.
Good morning. I'm sorry, real quick, Dr. Vegno, I know you already know this, but since you brought it up, you know, Cindy and I were in New Orleans East yesterday at the Cure Violence event, and they were also unveiling the partnership with the beauticians and the barbers. It seems like there's, you know, they already have and are cultivating that whole group of folks, that it might be a real, you know, since they're already doing it, it would probably be easier just to team up with them too while they're training them.
Yeah, we already have. Our NOLA Ready team is linked up with the barbers and the beauticians, so I'm excited about that. They're ambassadors, and I'm really hopeful that they'll be able to have, you know, long conversations with folks that might make them less hesitant.
Great, awesome. Thank you so much. Thank you, Chairman.
Thank you, ma'am. We do have a public comment. Jenna, if you would please, I think we just have one.
Yes, sir. There is just one public comment on this, and it's from Raina Wolf, not a paid representative. It is wonderful to see cases in New Orleans go down, but we need to create a national strategy to prepare for future pandemics. The Global Health Security Act helps save lives in the fight against global poverty and protects U.S. national security interests. Promoting global health security means the U.S. will be best equipped to respond to public health threats and prevent their spread across borders in the future. You can ask your representatives to support the Global Health Security Act by going to BorgenProject.org. The Borgen Project is a bipartisan national campaign that works to make poverty a focus of U.S. foreign policy. And that's the end of public comment for this item.
Thank you, ma'am. With that, we will move on to the next agenda item, the reopening of the New Orleans City Council chamber and other COVID-19 protocol updates. And the presenters are Paul Harang, the interim chief of staff of the City Council, and Dr. Jennifer Egdon as a repeat. You got an encore this morning. Paul?
Morning, Mr. Chair. Morning, council members. Happy birthday, council member Wynn. Nice to see you at work on your birthday. Council President Moreno asked me to put a presentation together. We've been working since the fall on how to get back into the council chamber for public meetings. We've been working with Dr. Avegno and her team, Homeland Security, the CAO's office, particularly Courtney Story, on this, capital projects, many others, on exactly how to get back in safely. So I'm going to start with how the council adjusted initially to the pandemic. So March 9th of 2020, we had the first reported case of COVID-19 in Louisiana. And then on March 16th, Mayor Cantrell declared a state of emergency and issued her stay home mandate. The rest of the council meetings for March and April were then canceled as the council regrouped. On April 15th, the council held its first regular meeting during the emergency declaration. We used Zoom to hold a video teleconference. This was authorized by the governor's proclamation, JB 2020-30, as well as an attorney general interpretation, and then ultimately Act 302 of the legislature, giving us regulations for how to operate virtual meetings during the pandemic. We've been broadcasting the meetings as usual on Cox Cable, on our website, council.nola.gov, and we added the council's YouTube channel, which provides another option that's, really user-friendly, a good way to go back and forth to find what items the council discussed. So as the numbers have been going down, as Dr. Avegno just presented on, the city's slowly been reopening. And as of last week, the city's now allowing for 100% capacity, or 250 people per indoor meeting space for public meetings. Now we're at 100% capacity, but you still have to maintain 6 feet of space and people still must be seated. So while we have a capacity of 250 people, in order to maintain 6 feet of space between individuals, we can only accommodate about 30 to 40 members of the public inside the council chamber. So we'll have seats closed off so people in different households don't congregate together. We'll meet people at the door and help escort them and put them in the right seating. We're at City Hall, so we're going to require a mask or face covering, as is practice now. Some other things we've been doing, we've been working with capital projects and our contractor VACCO to install safety glass in the council chamber. So you'll see in this middle picture, and Chairman Banks should be able to see this from where he's sitting, we've installed safety glass between the public speaking lectern and the presentation table. On the picture on the left-hand side, this is where the clerk staff receives public speaker cards. So we've got a barrier with a sort of a mail slot so that the clerk staff can assist members of the public as they fill out their speaker cards so that they can engage with the items up for consideration by the council. And then on the right, you see our IT specialist, Clarissa Phillips, is sitting at the Granicus station, which is, while it's more than 6 feet away from members up on the dais, it's below them and it's a little bit close. So we added a barrier there. As I mentioned earlier, with capacity, frequently we have council meetings where only 30 or 40 people show up. Frequently we have council meetings where 100 people show up. So we have overflow plans. We've worked with Cox Cable and our technical folks to run a cable to the breezeway right outside of the city hall, right outside of City Hall and the council chamber, in between City Hall and Civil District Court. We are gonna work with NOPD to block off that section and provide seating for members of the public. It's outdoors, so it's not as risky of an environment, and it's covered. So while it's gonna be hot, people won't get rained on in most situations. And we think this will be a good spot for overflow. People can monitor the meeting. We'll have a monitor out there with the meeting on. When their item comes up, they can come in to speak. And then when their item is up, they can either go back to the overflow area or leave the meeting. The seating arrangements for members and staff, we've rethought that. So if you take the entire council dais, which usually seats the 7 members of the council, the clerk, the deputy clerk, the council research officer, the council's executive council, and a representative from the law department, that council dais is only going to seat the 7 members of the council so that we can maintain 6 feet of distance, and you will still have your voting machines so that the meeting will operate as it has been, as it was before when we were in person. We'll move the clerk and deputy clerk down to the presenters table immediately in front of the dais. So they'll be sitting at this table in your middle picture here. And when someone presents, say someone from the administration or a stakeholder presenting on an item up for the council, we have the technological capability to run a presentation from the public speaking lectern, which is right on the other side of that glass. So that's where those presentations will take place. And then staff members, we're going to limit the number of members, of staff members that council members have behind them to 1 per member. And central staff, who's normally seated behind members, will occupy the ante rooms. There's an office room and a conference room behind the council dais. So they'll be sufficiently spaced out, masked up, monitoring the meeting there. And when it's time for them to come in and speak, they'll enter the chamber and assist with whatever item it is that they're there for, and then they'll retreat back to those rooms. We've learned a few lessons as we've operated virtually. We've allowed for this virtual written comment that people have really taken advantage of. We get frequently get over 100 or 200 comments per meeting, sometimes on a single item. And it's really expanded access to people who normally may not be able to get to the council chamber. So it's been an interesting lesson learned and a good way for the council to engage with the public and for the people to more effectively engage with the business of the government. So at least for now, while we're still under a declared emergency, we're going to continue with this virtual participation option. But because we'll meet all of the public meetings, open meetings law requirements by meeting in person, we won't have to do the public comment break at the beginning of a meeting. And we won't have to read out the agenda right at the beginning of the meeting. The agenda will be available to anyone, whether they're in person or virtual. And members of the public who are there in person, like I said, we'll have seats blocked off so that they're sufficiently distanced, and they'll be able to submit a speaker card the way that they were submitting before the pandemic began. We'll have folks in the overflow area when it's time for their item, they can come in and speak. And when the item they're there for is complete, we're going to ask them to leave the chamber to make room for other members of the public. One thing that I think will be useful going forward, even as we get out of this, is hybrid meetings. So we've, again, working with Clarissa Phillips, our IT specialist, and Kenny, our contractor who helps with Cox Cable, we figured out how to hold an in-person meeting and have a Zoom meeting happening at the same time. So say for the utilities committee, we have consultants and members of different companies that the council regulates who are often in other states. The city flies them down for these meetings, but we may have a way to save some costs by allowing them to participate virtually. They'll be up on the big monitor in the council chamber.
Mr. Chairman, can I jump in for 1 second on this one? Thank you, Mr. Chairman. Paul, I just want to say that you're absolutely right. This right here, I think, is the biggest item that's like going to really save the council, the city, when it comes to those coming in for our utility meetings who help regulate energy is going to save ratepayer dollars. This right here is really so key and big, because not only when some of these individuals fly down to the city of New Orleans, we have to not just only pay for their flight, we have to pay for their hotel, we have to pay for their meals. But I will also say this, oftentimes we really would like to have experts come in and speak to the council on a variety of different topics, but we can't do that because we don't have the available funds to fly them down and get their expertise before the council. So I think that this right here is so big. And I just really want to thank you, Paul and Clarissa and the folks from Cox for figuring this piece out, because I know that you would think it would be easy, but it was actually really complicated. And really, Paul, thank you so much for your team, Dr. Avegno, for your team, for really coming up with what Dr. Avegno, at least what you told me, is a safe plan to start having in-person meetings. After talking with Dr. Avegno and also talking with our executive counsel, Adam Swensick, that obviously safety first, but we also have legal requirements that we must fulfill. And if it is deemed that it is safe to return back in person, as Adam had explained to me, then we really have not much legal standing anymore to hold virtual meetings. So this, I believe the plan that you put together, Paul, meets both important pieces that we, the council, must meet. But Dr. Avegno, what are your thoughts on this plan? I know that you worked on it. Is this a safe way to start public meetings?
Yeah, thank you, council members, and to Paul, who I know has worked really, really hard on getting this done. I have reviewed the plan. It is completely in keeping with the guidance that is currently in place for the city of New Orleans in terms of the requirements for office buildings, the requirements for meeting rooms, and other similar events. So certainly with the enforcement of masking and distancing and the flow as it's been set forth, and it's safe. I think that council members will be well protected, as with their staff. And so you're right, as other cities like New York City just announced their municipal workers are coming back this week, as other cities who are in a similar situation as we are in terms of the outbreak are returning, this dovetails completely with what is safe at the present time.
I would say this too, that what I like about this plan is that for members of the public who are still hesitant, let's say, there are people who are not going out to dinners, that are still very guarded with what's happening with COVID, and they may have some underlying conditions, and so they're still very guarded. But this particular plan allows for someone to still be able to submit public comment online because we are not fully back open. So either you can come in public and show up and provide your public comment that way, or you can provide your public comment online, like we have been doing. So I think that piece is really key. I'm sorry, Mr. Chairman, I thought I had one question and I blew into like 5 more. So I'll turn it back over to you.
Paul, were you completed or you had more?
So that's I completed my presentation. I really just wanted to particularly thank the capital projects team, Vince Smith, in particular Ellen Wagasback, who she was key in the council chamber renovation that was completed a couple of years ago. And she worked with the contractor to get this stuff installed in a way that didn't permanently mar any of the, any of the old wood that we've had since the 1950s in this building. Really did it in a thoughtful way that respected the space, met our timeline. So I just wanted to thank her and the capital projects team.
Colleagues, any other questions?
Mr. Chair, I would just say that, I wanted the plan presented before we started, just putting that we would have public meetings, but based on everything that we're seeing here with this plan and due to Paul's great preparation, I believe that this Thursday will be our last virtual meeting. So we will begin having in-person council meetings 2 weeks after that. I don't know exactly that date, Paul, But for that next meeting after this one, we'll begin having the in-person meetings in the chamber.
Dr. Avegno, with the vaccine hesitancy and with the spread of the virus in India and other places around the world that don't have the luxury of the vaccine, are we ever going to get past this, or is this going to be our norm moving forward with these kinds of things that we have to do?
Boy, I hope so. How quickly we get back to normal really depends on the factors that you mentioned. You know, certainly coronavirus will always be with us. If it can become just another virus, like other coronaviruses that cause the common cold, or even like the flu, where we know what mitigation steps to take. We know that there's a vaccine. We know that there's some seasonal component to it and we can protect against it, but it's not overwhelming our hospitals and it's not causing, you know, mass deaths as you're seeing, you know, or as we saw at the beginning of the pandemic. Then I think we will all be comfortable going back to what looks a little bit more normal. That's not tomorrow. You know, it could be within a few months or it could take years. It also really depends on what the global, you know, as long as there are countries that are not fully vaccinated, the world is not protected. That being said, we know that these mitigation measures work. We know that mask wearing and distancing work and can help us reduce the illness and death on our way to full vaccination. So, you know, to me, it seems like a simple choice. We can get back to doing a lot of things if we just keep our masks on and are a little farther apart than we used to be. But, you know, business can commence in other ways, much like normal.
Thank you. Colleagues, any other further questions on this agenda item? All righty, with that, we will move on to agenda item number 5. Number 5. Dr. Avegno, and I understand Dr. Nichols is ill, so she won't be with us. So, Doc, this is the Dr. Jennifer Avegno show. You started that. So you have this one too, relative to ordinance calendar number 33305, the sale and possession of fentanyl test strips. So, ma'am, if you would, please.
Mr. Chairman, if you don't mind, since this is my ordinance, can I just start it off real quick?
Yes, ma'am.
So, you know, once again, a big thank you to our fantastic health department under the leadership of Dr. Avegno. Kind of an interesting story of how this came about. I happened to be in St. Roch at a neighborhood meeting. And at that particular meeting, I met a couple of harm reduction advocates. And they were telling me about fentanyl strips. Now, I had no idea what fentanyl testing strips even were, but they informed me that these are specific strips that you can test whether there's a presence of fentanyl in a narcotic. And what they later told me is that they were illegal in the city of New Orleans. And the reason why this is important is because it just makes all the sense in the world that if fentanyl is so incredibly deadly, and if someone, you know, happens to have heroin or cocaine and they test it, they see that fentanyl's there. I've read now studies that have shown that these individuals either won't take this drug because they don't want to overdose and die, or they will take other action to try to reduce harm to them if they take this drug. So, I mean, at the end of the day, having these fentanyl strips or providing them to people is actually a life-saving harm reduction type of initiative. But under the way that our code is written, when it comes to drug paraphernalia, it has something that is not legal in the city of New Orleans. So after I had met with some of these folks in St. Roch about this, I emailed and talked to Dr. Avegno, and she was already working on this particular matter with her team. So we just, you know, teamed up and said, let's get an ordinance going. And she sent me all the information that she had. And it just, once again, it's just something that is urgent, necessary. And I'm just so thankful that we do have a health department that's already on top of these things, noticing these things and ready to act. And I'm so fortunate that we have a council that realizes the importance of moving important ordinances like this in an urgent and immediate fashion, so that we can do what we can to provide needed resources to those individuals who are suffering from addiction so that they can stay alive. So with that, Dr. Avegno, I'll turn it over to you.
Thank you so much, Councilmember Moreno. I'm really glad to be here speaking on this topic today. You know, it's not often that you can immediately see the life-saving potential of a particular regulation or ordinance, but this is a case in which we can, and it is urgently needed. Just in the last week, we've had several people die of overdoses that, while we don't have the final toxicology results, almost certainly, at least some of them were linked to fentanyl. So there is really, you know, no greater or more pressing need right now as one of our harm reduction goals. And I just want to thank my team at the health department, Byrne Sherwood, who leads our behavioral health department, and Dana Wilkosh, who is our relatively new harm reduction outreach education coordinator. So lots of work to come from there. Next slide. So I just want to spend a second talking about where we are with the opioid epidemic. There was some information that came out in the last week or two from the CDC about the sharp rise in overdoses reported between May 2019 to May 2020, so including several months of the pandemic. 80,000 plus overdose deaths in America. That is a staggering number, and it comes at a time when we were beginning to make some progress in the opioid epidemic. This is a huge setback. This is all overdoses, but the majority of them involved at least one opioid, and of those opioids, almost 80% tested positive for synthetic opioids, including fentanyl, and I'll get into exactly what the difference is. This is a huge increase, and it reflects what is being manufactured right now and put onto the streets. Next slide. This is a particular concern for Louisiana. We cannot hide behind anything anymore. Louisiana was the state with the largest increase in drug overdose deaths in this time period, and we're second only to DC. So 54% increase in deaths. In New Orleans, we saw a very similar number, 241 overdose deaths up to 365. That's one per day. That's an individual lost per day solely to drug overdose. Again, reflecting national trends, about 80% were testing positive for fentanyl. New Orleans EMS, and I'm sorry my colleague Dr. Nichols can't be here today, is really on the front lines of this. They are all very trained, very well practiced in administering Narcan or naloxone, which is the life-saving reversal agent for an opioid overdose. They have seen their numbers steadily rise. And this can't all be blamed on the pandemic. They actually noticed this rise in the last quarters of 2019. Really unclear what was happening other than the introduction or widespread introduction of fentanyl, which we suspect is one of the driving causes for this. Dr. McKenna, I think, said it best: street drugs in New Orleans are more deadly than they have ever been. So even for folks who have been using for many, many years and who have a sense of how the drugs affect them, there is really no way to tell. And they are far more at risk of accidental death and overdose than they ever have been. Next slide. So what is fentanyl? When we think of what an opioid is, and an opioid is a class of drugs that is a sedative. It generally makes people very, very sleepy to the point where they can stop breathing and die because of that in many cases. So most people think of heroin, which is the primary sort of drug of abuse in this category. Fentanyl, there are many, many types of opioids that are used for very legitimate medicinal purposes. So when you come into the emergency department and you have a broken leg that is severely painful, we would give you an opioid in order to ease your pain because it works best. There are several different kinds of opioids that we would use in a safe, controlled medical environment. Fentanyl is one of those, and we do use it frequently for severe pain. Folks with advanced cancer who have severe pain from cancer are often on fentanyl, and that is an appropriate drug for them because of their medical condition. This drug, however, is 50 times more potent than heroin and 100 times more potent than morphine, which is an old-fashioned but still well-used drug in hospitals. I really can't stress the power of this drug and how a minute amount can kill. It is very, very cheap to manufacture, which is why you are seeing it in the US and other places today, because it can be manufactured very inexpensively, oftentimes in China or other places overseas, and shipped and mixed with heroin, cocaine, or other pills, such that the user might have no idea that the fentanyl is even in there or what the concentration of fentanyl is. Of course, there's no regulation of this because it's an illegal drug, and so the amounts can vary incredibly widely. Next slide. So what is harm reduction? Harm reduction is a tool and one public health strategy in concert with others that helps to understand that individuals are engaging in behaviors that are incredibly risky and can cause harm to them and others. How do we mitigate those harms? Rather than completely outlawing the behavior and understanding that that generally does not work and in many cases causes more harm. How can we go about mitigating behaviors to keep people alive, to keep people healthy, so that we can work on the long-term work of addressing what is leading to those behaviors in the first place? So we use this all the time. This is sex ed in high schools. It's condoms to reduce pregnancies and other sexually transmitted diseases, including HIV and gonorrhea. These are highly, highly effective strategies. Seatbelt laws are a form of harm reduction, right? You might drive fast and break laws. That's not going to necessarily stop you from getting in the crash, but the seatbelt is going to protect you from dying. In New Orleans, we have authorized syringe service programs, for those who use IV drugs to obtain clean needles, because what we find is the rates of HIV and hepatitis soar when these programs are not instituted, and the long-term effects of HIV and hepatitis on the community and the individual are devastating. So we have a long tradition of harm reduction, and there's a lot of evidence that it works. It does not fix the underlying problem, but it helps to mitigate disease and death. Next slide. Fentanyl test strips are part of harm reduction. They are very simple to use. As you can see, they look like a pregnancy test, right? Everybody can use this. What they allow users to do is to take their quantity of drug very quickly, very effectively, test to see if there is fentanyl in that. If there is fentanyl, they know that it is more likely to be far more potent than they would have expected and can change their behavior. These test strips have been around for a while. They're not new. A breakthrough happened a couple of weeks ago when the federal government allowed for funding to be able to purchase them. So the federal government is now, agreeing that these are useful in the harm reduction model, and so they should be treated like other sort of parts of that model and not discriminated against. Right now, as it stands, we cannot use them in the city of New Orleans. We cannot distribute them or allow others to use them because they would be considered paraphernalia if they were found on a person, and that would further criminalize that individual's actions rather than protecting them and getting them to the point where they can seek the help that they need. Next slide. So what do we know about the test strips as a harm reduction strategy? What they do is give a sense of empowerment to individuals who are using drugs. Again, this is one part of a strategy. the ultimate goal is for folks to be able to understand their drug use and to seek treatment, appropriate treatment. But what we know is that for those who do have access to fentanyl test strips, they use them and they modify their behavior. Our community who does use opiates no one wants to die of fentanyl. They want to know whether it's there and they want to make better choices about their risk. So they are effective. Next slide. And I think this is just sort of in summary. I am incredibly concerned that we are at the tip of the iceberg in terms of a resurgence of overdose deaths. Number one, due to the widespread availability of synthetic drugs like fentanyl and the resurgence of other drugs like meth and cocaine, the destabilization of the economy and society due to COVID-19, changing distribution habits, it's really does not look good. So anything we can do to mitigate what may come, we need to do now, particularly with a drug that is involved in 80% of our fatal overdoses. So this is a small step that I think we will see immediate dividends. And I know our advocates are really excited about it. It just gives us one more tool. So thank you. Thank you to my team for helping with this. And we're pleased to support this ordinance.
And Dr. Avegno, I think what's so important about this, and you mentioned it a bit, is that with the passage of this ordinance, well, then it would allow for example, the city, just like it does with Narcan, to be able to purchase these test strips and be able to provide them to nonprofits and clinics so that they would be available in the community. Is that correct?
That is correct. And we are ready to go as soon as the ordinance is, we've already identified, where to buy them and have some plans on how to distribute them initially.
And what is the cost of a strip? From what I understand, it's not very expensive.
That's a good question. I just looked at the figure. It's not. It's dollars, if that much. It's not, hundreds of dollars per strip. It's pretty inexpensive.
Like $1 per strip.
Yeah, I think that's about right.
And just another quick question also on this harm reduction piece. Tell me a little bit about what's happening with purchasing Narcan, naloxone. I know that we had, because of your leadership, found some funding through an old fund that had been sitting there with money in it and not utilized, and we decided to use it for the purchase of more Narcan for our community. What's happening with that? How's that going and the distribution?
I'm excited to report it looks like our RFP process should start this week. We're using that funding in a couple of different ways. One is an RFP for community partners, syringe service programs, anyone who interfaces with the drug using community on a regular basis to apply for and to be able to get a large quantity of naloxone so that they can distribute it regularly and in a much bigger quantity. We've also purchased naloxone that we're going to be using in our bystander trainings, which Dana from my department is leading. We did these before COVID, and we're at the library. I think some of you might have taken them, and we're excited to get them started again. And she's been doing a lot of outreach to bars and neighborhood spaces to train, bartenders, for example, or employees, and to provide the Narcan there. And we're really looking at how to get them in the hands of our most vulnerable individuals. So those individuals who are unsheltered, homeless. We've done trainings for shelter staff, and we want to make sure that they are fully equipped with Narcan so that if something happens to their population, but we really want to get this to as many folks as possible. So as our COVID restrictions are easing, that's going to allow us to be face-to-face with a lot more people and provide them with Narcan and with fentanyl strips when it's available. We'd love to be able to give them both at the same time.
Really fantastic. And just for council members, as you look at the ordinance, the real applicable piece is actually on page 3, which lists the exception on the drug paraphernalia. And so you'll see that the new exception would be for the possession or the sale of rapid fentanyl test strips. So just wanted you all to know that's where it is in the particular ordinance. So thank you, Dr. Vegno. Thanks, Mr. Chair.
Colleagues, any questions?
I have a question.
Okay, go ahead.
Thank you so much. Thank you so much, Dr. Vegna, for being here. And Councilman Moran, thank you so much for bringing the ordinance. I'd love to have my name added to this. I know this is a huge issue that affects families all over the city. You know, I lost a nephew to a overdose of heroin, but it also had, you know, trace amounts of fentanyl in there. At the same time, caring for my mother who was, you know, in stage 4 breast cancer and needing fentanyl to help with that as well, right? So there is a need for that. And we also know there's a black market for those fentanyl patches as well in the city. When we talk about the distribution of them, so I think it's great that basically what this ordinance will do is allow people to be able to carry the strips, right, and make them legal. The question is, like, also what is the best way of distributing the strips as well, right? Because do we have places where people can shoot up legally? You know, we don't have those types of facilities in this city yet, right? So how will they know how to access them? Because, you know, we don't want to be in a situation where we're distributing them after the fact, right? That, you know, our healthcare providers aren't going to know, you know, when and where people are going to be shooting up. So to me, I think the distribution aspect of this is even more important.
Yeah, that's true. And that's why our syringe access programs are a really key point, because they are regularly interfacing with hundreds, if not more, of individuals who are there because they've already committed to harm reduction. They're already wanting to have clean needles so that they do not contract, you know, HIV or Hep C or another disease. And so at the same time, being able to hand out the fentanyl test strips, Narcan at those, and those are regular events, right? So those are, you know, several times a week, depending on where they are. And it's, you know, sort of regular clientele. That I think is going to be a really fertile place to do them. And then, you know, as I was saying, anywhere that we are doing training or giving out Narcan, it makes sense to hand them out as well. I will remind people that there is still a standing order in the city of New Orleans and in the state of Louisiana. You can go to any pharmacy and purchase Narcan without a prescription. That's been in place for several years. I actually did it myself just to test it out a few years ago. You know, if anybody has any problems, please report that to my department. But we don't even want that to be a barrier. So every place that we can be to interface with the community, you know, in my mind, we would give out Narcan. And if there's a need to give out fentanyl strips at the same time, it makes sense to me.
So then our Department of Public Health will be purchasing the strips, and then also will other drug treatment centers and places that have
Sure.
distribution?
Now they can, yeah. Now that there's, especially now that you can use federal funding for it, I think that's going to open it up for a lot of other places to be able to purchase it. But certainly, we will purchase whatever we can, and distribute it to our partners.
Okay. And so this leads me to the next question. I know it's not necessarily on the agenda, but I think this is all interrelated in terms of a conversation about drugs and heroin and overdoses and shooting up. And we know we see a rise of this in all of our public spaces and even our not so public spaces, right? So what is your position in terms of having safe places for people to shoot up and to go to? And do you find them effective? First off, we know it's effective, right, for the person that's shooting up, and it can often prevent overdoses. But secondarily, and also treatment, do you find them, is that something that you would advocate for, this administration would advocate for?
So we have looked at that. To my knowledge, only Philadelphia has a safe injection site because the legal and the liability issues are really, really formidable. And so that's been prohibitive for a lot of cities taking that step. I know that's something on the agenda of some of our advocates, and I definitely think it's worth looking into what parts of it are valuable and what can be done. I would, for myself personally, I think in our the way we've looked at it is we really want to invest in medication-assisted treatment availability widespread. If we're going to have money to do it, that we know saves lives and provides long-term benefits to treatment. And so that's something, there's been some good news there. Now they've removed some of the requirements to prescribe medication-assisted treatment that was a barrier for physicians. I know that our clinics are starting to ramp up again the number of MAT patients. Our Healthcare for the Homeless clinic sees MAT patients. That's something I think that for now we probably concentrate more energy in, but that is on the list of interventions to look at as a safe injection site. It's complicated.
Thank you, Dr. Vegno, I appreciate it.
And just real quick, Kristen, to your first question about the distribution piece, Crescent Care is really a great partner. They provide, syringe materials, naloxone, and I know that they're from what I hear, they're super interested in this as well. But that's a really great organization, and they're just very well committed to the community and in keeping people safe.
Any other comments? All right, just let me chime in. I'd also like to add my name. We as lawmakers have to be nimble enough to adjust to the world as it evolves. And obviously, when this was written way back when, the concern that we have today wasn't relevant then. So I'm excited to be able to join with this. This to me is no different than having a safe needle distribution to avoid the transmission of blood-borne diseases, or having a condom distribution to help prohibit or limit the spread of AIDS and STDs. So this is a no-brainer, and I would expect that hopefully we will get full support of the council on this. I know that we've got 2 public comments, so if we could get those before we call for the vote. Matthew?
Yes, sir. Can you hear me?
Yes, sir.
All right. The first public comment is from Andre Godin Jr. He is not a paid representative. As a prosecutor with over a decade of experience and the new chief of the Orleans Parish District Attorney's Office of Drug Trafficking Unit, I have seen the opioid epidemic arrive in New Orleans and go from bad to worse. This past year, opioid-related overdoses in New Orleans have skyrocketed. The dangerous synthetic opioid fentanyl is largely responsible for fatal drug overdoses in our community. To make matters worse, drug distributions have begun to cut fentanyl into other illegal narcotics, exposing entirely unaware communities of users to this overly potent drug. Fentanyl testing strips are a critical tool that addicts can use to prevent drug overdoses from occurring, and are an integral part of the high quality and evidence-based harm reduction services. These inexpensive tests can be utilized by drug users to test for the presence of fentanyl in their drugs. Further, these tests have been scientifically associated with positive changes in drug use behavior. Unfortunately, these testing strips are still considered paraphernalia, and that is preventing programs such as Crescent Care from distributing them to the communities who desperately need them. By empowering syringe service providers to better serve their clients and facilitating the widespread use of fentanyl testing strips, Ordinance Calendar Number 33305 will improve the harm reduction capabilities of organizations in our city. And the last public comment is from Jason Rogers Williams, the Orleans Parish District Attorney, and he is not a paid representative. As District Attorney of New Orleans, I and my administration fully support Ordinance Calendar Number 33305 and fully support the mayor's and city council's efforts to save lives from the unprecedented dangers posed by the synthetic opioid fentanyl. In 2020, opioid-related overdoses spiraled out of control, with much of this trend driven by the rise of the fentanyl on our streets. We must confront the death and suffering caused by drug overdoses, and fentanyl testing strips are a vital tool in reducing the number of these overdoses. The testing strips are cheap and easy to use, and they can save lives. As part of my office's broader narcotics policy that I previewed at last week's Criminal Justice Committee meeting, I'm committed to focusing our resources on the serial and organized crimes affecting our neighborhoods, including violent drug traffickers. The DA's office will soon unveil a specialized drug trafficking unit as part of this initiative. By focusing our resources in this way and by treating those with chemical dependency rather than by prosecuting them, we will increase safety and deliver justice to New Orleans. And those are all the public comments for this agenda item.
Thank you. So that, Madam President, would you like to move for adoption of the ordinance?
Yes, sir. I'll make a motion to send to adopt to the full council.
All right, I'll second.
Elena, can you add my name to the ordinance too? Thank you.
All right, all in favor, say aye.
Aye.
Any opposed? All right, so that is adopted unanimously to proceed on to the full council. So with that, thank you all. Moving on to our final agenda item is the presentation of Community Visions Limited, a presentation on the programs to rebuild neighborhoods through beautification and empowerment. And the presenter is Jeannie P. Titty.
Tidy, like a neat person.
Tidy, I'm sorry, forgive me.
That's all right.
I will not make that mistake again, thank you. If you would, please proceed.
Well, I just wanted to tell you all a little bit about Community Visions. Now, when we first started in 1994, there were over 100 vacant blighted buildings in the area between Broad and the Bayou and Ursuline and Orleans. And within a year, we had 75 projects going because we were able to strong arm at that time Whitney Bank to help people do interim financing. Now that's not as much of an issue. But that's how we got started. And then after Katrina, so many neighborhoods were having a problem. And I noticed in my neighborhood at that time in Lakeview that the graffiti was out of control on the utility boxes on the neutral ground. I also had a lot of artist friends who were suffering and couldn't get work. And so I thought, well, this was a win-win, that we would do, boxes. I could raise the money, pay the artist a stipend, and promote their work. So out of 65 of those original artists that we had, 50 of them have received commission work because of this project. And a lot of them have told us that if it weren't for this project over the past year, that they would have had a much harder time. So we continued to raise money in the pandemic by doing an online auction of the mini boxes, which we still do, and we split all the proceeds with the artists themselves. But it's been very successful, and we work with each neighborhood. They assign a person for us. So we don't decide on the artwork ourselves. What we do is we have a committee, and it's made up of a neighborhood representative and 2 arts people. And when the artists do a rendering, we see it and we know who they are, but then it's sent blind to that committee. So it's a very fair process with getting the artist work. And also we want to highlight the culture of each neighborhood. Every neighborhood is different in New Orleans, and every neighborhood has their certain little cultural icons, like Leah Chase, like we have all the musicians up Rampart and on Canal Street, and it makes a huge difference. And I none of the boxes, well, 3 of them were tagged, but we go out immediately and get rid of the tagging. So it really has helped the neighborhoods get rid of the graffiti in their areas. In addition to that, we did 5 gardens in the Gentilly area last year, hoping that that's gonna, help create hopefulness in the neighborhood and some beauty. So basically that's what we do, and we've been doing it a long time. And we also, I know you all have gotten my letters, so We send a lot of letters to the council about blighted properties in neighborhoods because the neighbors themselves ask us to do that. That's basically it.
Any questions?
Are there any questions?
Colleagues, do you have any questions? Kristen, I see.
Yes.
Go ahead.
Hey, Kristen.
Hey, Jean.
Hey, how are you?
I was so excited to see that you were going to be on the agenda. Sorry, Mr. Chair. Jeannie and I go way back. I'm not going to tell you how many years ago that was. But we worked together down there in the Lower Garden District.
Right.
Working in that community and in that neighborhood for years and trying to revitalize it and keep neighbors living in that neighborhood and prevent gentrification. It was wonderful.
Exactly.
So I can see why you're doing what you're doing now. I just want to thank you. You know, it's just such a pleasure to drive around the city and see the different boxes and what you have done. It's been really, really wonderful. And I want to say, I know what a difference it makes because we were down in St. Rock a few weeks ago and we did a community cleanup and we painted all the boxes, you know, a dark green because they didn't have murals on them and they're constantly tagged with graffiti, right? And they were really excited because they're trying to figure out how they can, I think y'all are going to do some on Franklin, maybe?
We have done some down there. We did one right by St. Rock on, well, it's on, not Franklin, it's on St. Claude at St. Rock.
Right.
And it's St. Claude and Elysian Fields. And they haven't been damaged.
No, not at all. But we have
And we just need more money. But I tell people that's the only thing that stops me is not having enough money, because our $39,000 a year budget, 20,000 of that goes to artists for their stipends, and 19,000 goes to supplies and paint because we furnish them with all the materials, and no one here takes a salary. So I just want people to know that. They think that we do, but nobody here does. And I don't know when we might be able to, but I don't see that changing. So we do work really hard to raise the money. We feel like it's very important to the neighborhoods and to the artists as well. So it has helped them. A lot of them have told me they've gotten good commission work. 4 of them are in galleries now that they weren't in before. So I do think it gives them a really good leg up, you know, to be able to do the projects, and they get a lot of good PR from it because we post it on Facebook and Twitter and our website, and I just think it really helps them. So, and they are, people don't realize this, but artists are an economic engine like no other. For every dollar they make, they spend $1 in their community. And I think that it's often overlooked for the economic development of the city, because it is true. They spend more money than other people in the area. And that's what I really felt was important, was to help the artists get back on their feet after Katrina, help the neighborhoods get back on their feet as well. And I mean, it has just taken off like crazy. So anytime we write a grant for Caesars or anything else, we would greatly appreciate the council helping us, because that is the only thing that stops us from doing boxes. And you can tell me, I want this money to go towards these 4 boxes or these 3 boxes in a neighborhood, and we will do it. And we have finally, it looks like, maybe gotten permission from AT&T, not in writing yet, but you all can put some pressure on them, because the neighborhoods have really been upset that they won't allow us to paint their boxes, and they get graffitied all the time. And we did get Cox to allow us to paint one of their boxes, and we've gotten a little bit, I think we're starting to get less resistance from AT&T. At least I hope so. That's my hope. So that's basically what we do, and it's a very fair process, as I said.
Well, don't we, Chairman, don't we regulate these utilities, and are they through like utilities council? I don't see why we couldn't write a letter to AT&T and all of them you know, requesting that they work in partnership with her group, because it really does prevent graffiti. I got to tell you. I mean,
It
boxes
does.
that you do and your artists do are not graffitied. The boxes that don't have the beauty,
Anything,
those are the ones that are graffitied. And so,
constantly,
yeah.
constantly.
I would be glad to sponsor a letter.
Oh, good. Do that. That would help. And we also are now looking at maybe doing some of the overpasses from the railroad because they are so bad. And the graffiti, for instance, at Franklin exit off of I-10, oh my God, it is so bad there. And in the park, I mean, there are just so many areas like that. So we would like to be able to do murals. And again, it's money to be able to pay the artist and furnish the materials and the time. But I think it would really make a big difference in, I mean, these are entrances into our neighborhoods. And why would you allow graffiti like that without trying to do something about it? And I find that the graffiti artists themselves, I think they really kind of say, okay, well, this is an artist's work. I'm not going to mess it up. And I really do believe that overall, or we would have had so many of them tagged and ruined. And we've learned things, you know, and we do use the best paint possible. And it is a Benjamin Moore house paint that's high gloss, but it has held up. And we use a $50 a gallon primer to get it ready. And all the boxes are, initially, we try to get every sticker off, all the graffiti off, and then we wash the whole thing with a vinegar water solution to help etch the metal to have the paint adhere better. And then we do 2 to 3 coats of primer, depending on how bad the box was, before the artist gets it. Then they come behind us and do their design. So it's a process that we did a lot of research on to make sure that the paint we used would hold up in our hot climate with so much rain. So it has. And I mean, some of them now have been up 10 years and they're still going. They still maybe a little faded, but they still look good. They're not peeling and they're not having a lot of problems. So, and we do try to maintain the boxes. If I see one not looking great, I'll ask the artist to go back out there and fluff it up. And we pay them for that too. So it's a way for them to get extra money as well. But that's pretty much it. And we just, our whole thing is not having funding. So if we had more funding, imagine, we'd have all 400 in Orleans Parish done. And we've done 256, and another one is underway right now. So that'll be 257.
Well, Jeannie, thank you so much. I can't speak any more highly on this program. I know I'm working with the St. Roch Neighborhood Associations and others, like if we can fundraise too, to get these done. How much is like an average box cost?
$750.
$750.
And that's, we pay the artist $300, and their paint kit alone is like $100 because we have to give them quarts of really good paint. And then the primer is $50 a gallon. So we don't make money off of it, I'll just tell you, but that is what the costs are to us. And we try to keep more of the money going towards the artist and less on materials.
Right.
That's pretty much what we do.
And I'm really glad you brought up how artists, our visual artists, are economic drivers. I think people.
They are. They really are. And people don't appreciate or think about it. But I can tell you that this project has really helped a lot of them, and they've gotten commission work from it, as well as in galleries. So now their work is more accepted than it was before. And it's a way for them to get their name out there.
That's great. I know we've had some local artists in Algiers have done our boxes. And so thank you too for matching some of the local graphically in their neighborhoods. I think that's really thoughtful.
Yes, we did. We do. We try to keep, if an artist lives in the neighborhood, we try to give them first dibs, but they don't always apply. So it's not a guarantee, but we do try to give them first druthers when they apply for one that's right around the corner from their house. So That's pretty much it. And I would encourage anybody who is interested in this program, Give NOLA Day is going on now. So get on there and give. We can do more boxes.
Ms. Title, would you just please specify the name that they're looking for on Give NOLA Day? And even if they want to do something after Give NOLA Day, how does someone find you to be able to make a donation if they want to, say, buy a box or 10?
Okay, it's Community Visions Unlimited or cvunola.org is our website. And the cvunola.org has a direct link to the Give NOLA Day, and it also has a donate page afterwards after Give NOLA Day. So we have both of those links on the website, the cvunola.org.
Well, I want to join my colleague in commending you all for the wonderful work that you're doing. The boxes are beautiful. I was passing not very long ago and saw James Rivers at the corner of Louisiana Avenue and Carondelet, and just got so excited because I am a very big James Rivers fan.
That's right. You helped get those boxes done in that area, and we owe you 2 more, but the city has ripped them up on the neutral ground. So I have to wait for them to put the boxes back so we can paint them. So
well, I'm looking forward to the boxes coming back, because I think that these really do help enhance not only the beauty of our city, but it also helps promote our culture, and all that is intertwined with each other. So I think that this is a really good program. And I encourage any and everybody out there, if you can help, please help them, because they do wonderful, wonderful work. And it does make our city look a lot better. Kristen,
you so much.
Yeah, I just have one quick follow-up question. And also makes our lives better when you're sitting at a stoplight and you're bored.
Yeah.
And see a piece of art, right?
That's right.
Or if you're waiting for a bus or a streetcar, it helps lift the human spirit. So I want to thank you on that. Do any of the utilities give you donations like Entergy or AT&T?
No. No, and actually our first grant, the first grant that we got was from AT&T. That's what's so weird, and they won't let us do their boxes. And that was through Susan Gidry. She got us that grant. But no, most of our grant money comes from the Wisner Foundation, the Rosemary, Ella West Freeman. I mean, all of those foundations have donated to us, but no, not Entergy has never given us a penny, and they should. And so should Cox. They should give us money too. Anyway, it's just very hard, and it's a difficult time, I know, because a lot of people, they don't have jobs, or their job is not back up 100% yet. So I do know that it is hard on people now. So that is why last year during COVID, we created the mini box auction that you can order online any box that has been done, as long as the artist says, okay, I'll do it. And for $300, you can get a little great piece of art, and they have little tops on them, so you can open them up. It's a good place to stow your keys or whatever. And the thing is, we give them half of the money. So they get $150. And last year they said that really helped them tremendously. So that's, any other question? Thank you all so much. And thank you for having me in front of the council. And just remember that all the work we do really helps our community as a whole, because it's an economic driver. It helps the artists. The artists go out into the community and spend their money. And it just helps give people a lot of hope. And we have had little kids who've made a game of telling me which ones are their favorite boxes. And they said, oh, I just saw this one. This is really my favorite. And then a week later, one little guy was doing them all the time. He was so cute. And his mother said, I can't stop him. He loves all of them. Every time we go to a light, he says, oh, that's a new box. I didn't see that one before. So they do pay attention to it, and it does give people inspiration, I hope. and hope for the neighborhood. You know, it makes the neighborhood look better. And just appreciating our local people, you know, people who have been around a long time. And I really think the Musician Project is one of those that people have really loved, and we're going to continue those as well. So that's basically it. cbunola.org.
Ms. Tidy, thank you so much. And we really appreciate all the work that you all are doing to help make our city much more beautiful. With that, colleagues, that concludes our agenda. If there are no further comments, I will entertain a motion for adjournment.
So moved.
Second, all in favor, say aye.
Aye.
Aye, so I think it's unanimous. There are no nays. So with that, folks, we will stand adjourned. I would strongly encourage each of you, if you have not gotten a vaccination, please go and get one. And even if you have a vaccination, please continue to wear your mask. We are far from out of this. Everybody, please be safe and take care. Thank you.
Thank you.